We are back with Dr. Kenneth Hilty with Cone Health Heart Care, taking all your questions and things of what you want to know about controlling your cholesterol. So let's talk about this, because this is what we want to know. Food, how does what we eat impact our cholesterol?
So it's critically important. In fact, what primarily drives our cholesterol actually is fats, right? So saturated fats, and the most common offenders are fried foods, butters, cheeses, oils, things of that sort. So trying to lower fats in our diet, most people think just cholesterol sources like meats, but in fact that those fats drive the cholesterol numbers to be much higher. So low fat diet, high in fiber can actually help reduce cholesterol.
Okay, so let's also talk about exercise, lowering cholesterol levels. How much exercise is needed to make a difference?
It can make a significant difference, and primarily it comes from both weight loss, but independent of that, even if you exercise and you don't lose weight, your cholesterol can come down. Particularly if we look at like triglycerides, for example, the triglycerides are energy sources in our body. So when we exercise every day and utilize that energy source, we can really maintain our triglyceride levels to be lower.
Okay, gotcha. So how do genes impact our cholesterol levels? We heard from the rabbi earlier about how it kind of like went in his family. What should people with a family history of high cholesterol do?
Absolutely. I think, that's been the biggest predictor for me over the years, is looking at families and family history, right? It gives us a roadmap and what potentially a patient could inherit. If your cholesterol is elevated in the family, or you have early onset heart disease and risk factors, I think just starting with getting a cholesterol test is a good starting point. And if your cholesterol numbers are high, then we can talk about how do we best lower that. It's a combination, usually diet, lifestyle, exercise. But it really starts with just recognizing that the risk is there.
Gotcha. And you said you would start with diet, exercise, that kind of thing. When might medications be necessary?
I think we reach for medication oftentimes when the cholesterol is very high, or in patients who, for example, do all those things that lead a healthy lifestyle, that already are eating a good healthy diet, or maybe made those lifestyle changes and find that their cholesterol doesn't improve. And there are, other certain tests that we can do to suggest that cholesterol might be genetic. For example, genetic testing, testing for something called lipoprotein(a), which is an inherited type of LDL cholesterol. These kind of things are unfortunately not improved with just diet and exercise alone, and you would probably need some type of medical therapy for that.
Okay, and who should someone contact if they're concerned about their cholesterol? Do they just talk to their primary physician about it?
I would certainly start with the primary physician. There are a lot of people that do what I do. It's a very specialized lipid management, but there are wonderful primary care physicians all over the area, and I think that as an internal medicine doctor and a cardiologist in training, when I train, we learn to manage cholesterol, and I think that our primary care providers do a very good job of that. There are patients that are very challenging that I end up seeing, but I think in general that's a great place to start. And I think most patients can get very good care through their primary care providers. We're certainly happy to see the more difficult cases and kind of more exotic cases and things that we can certainly help with.
Okay, great. Well, we thank you for your time and your expertise, and letting us know that we need to make sure that we get screened, and that we need to pay attention to that diet and that exercise for sure. Thank you so much. If you missed any of this is going to be in the To Your Wellbeing section of our website, WFNYnews2.com.